Hi, welcome back to The Spark is Love. Today we're going to talk about hypertension or high blood pressure. Now, bear with me. There is a lot to be said on this topic, but it is important. They call hypertension the silent killer. Why? Because usually most of us walk around and our blood pressure is really, really high and we don't know about it. There is no alarming signal that your blood pressure is high. And because of that, it can creep up on you and it's not limited to age, gender. It can happen to anybody at any time. So it's really important that I spend some time talking about hypertension. Now, of course, I'm using my guide. It's a patient education from the Food and Drug Administration. And I'm just going to go through just a few tips and put my nursing 2 cents in it, okay? So, first of all, I want you to know that this is serious. People can die from high blood pressure. Now, I'm not saying this to scare you, but I'm saying it for you to take it seriously, right? It is not just, oh, my pressure is a little high. First of all, let's talk about what is a little high. So, what is a normal blood pressure? What is blood pressure? Okay, so blood pressure, first of all, it's when your heart, it is the pressure, right? That, or the force that your heart is pumping out the blood, right? That's just my broken down way to tell you what blood pressure is. So, usually at times that fluctuates. You have fight or flight. So, if you're stressed out and you're worried and you're anxious, you're going to signal that fight or flight hormones and your blood pressure increases, right? To give you that energy and that force to go and fight and do whatever. But usually in life, we're stressed out. So that's just subliminal, normal stress, right? And what happens is over time that blood pressure increases. So according to the FDA, anything above 120 over 80 is an abnormal blood pressure reading. So to be normal, you want to come below 120 over 80. Now, there are different types of hypertension. You have gestational hypertension, right? Which it says after you're 20 weeks pregnant, right? And your blood pressure becomes elevated, you could be diagnosed with gestational hypertension. Then you have chronic hypertension, which has nothing to do with pregnancy. It's just you have a elevated blood pressure, and usually your doctor, your provider, will diagnose you after some time of elevated readings, okay? And then you have, in women especially, well, it only happens in women because we give birth, preeclampsia. And this is actually a very, if you have preeclampsia or high blood pressure during pregnancy or post pregnancy, your doctor will keep a very, very close watch on you because it can affect mom and baby. Okay? Not alarming, just to be aware. Okay, so let's talk about high blood pressure medications because there are so many. And not only are there a lot of blood pressure medications, but there are a lot of classes and combinations of medication. So before you start on any medication for controlling your blood pressure levels, please be sure to check with a provider. Your doctor will want to know not just what medications to put you on, but what medications do you already take? Okay? Some side effects of these medications are cough, dizziness, tiredness, headaches, problems sleeping, dry mouth, the list goes on. So you want to communicate well with your doctor because there are so many different classes of medications. Your doctor can choose one where maybe the side effects are low and the benefits are high. Something I want to say about blood pressure medications. It is important to not hard stop these medications. So if for some reason you're going to foresee maybe you're running out of money, insurance is not covering it anymore, or you don't like the side effects, give yourself enough time to have that communication with your provider so that you will not injure yourself in the process. Okay? Another thing about blood pressure medications is that a lot of it can control your heart. So you want to be careful on if you are feeling any kind of unusual, abnormal palpitations of the heart or heart activity, you want to be sure to reach out to your provider. Now, if you like me and you don't like medicine, I was diagnosed postpartum with hypertension, and I knew I did not want to be on medication for the rest of my life. But I knew that I needed to be on some kind of medication because the numbers couldn't stay so high. So what I did is that I worked a plan with my doctor so that I can do all the things that I need to do to decrease my blood pressure levels. So exercise, right? Eating a healthy, nutritious diet, right? And reducing my stress levels. All of these things in combination I did to bring my blood pressure down. Now, if you are like me and you say, hey, I want to do proactively the things to bring my blood pressure down, just a little warning I would give you is to make sure that you are checking your blood pressure, because you don't want to be doing these things and taking your medication and then your blood pressure drops and then you start feeling lightheaded, dizzy, or faint. Okay? So make sure that you are working for any medication you're taking, but especially for blood pressure medication, make sure that you're working in conjunction with your provider. And if your blood pressure does come down, that is not signal to just throw away the pills, okay? You have to wean yourself off of these medications. And when I say you have to, that is you and your doctor planning together, okay? But you could do it. It is possible. It is possible to make healthy lifestyle changes. But you want to make sure that when you're taking your medication, you don't sabotage yourself by doing what you want to do. These are powerful drugs, okay? So even if you start feeling better, even if your blood pressure is controlled, definitely have that conversation with your provider. Okay, so these are some things I want to share. Just a couple notes of what are warning signs when you're taking any blood pressure medication would be allergic reaction, of course, chest pain, fainting, irregular heartbeat, swelling in the hands, face, lips, legs, right? Some of these medications, they can give you problems breathing, and it can give you skin tingling, numbness. It goes on. Every drug has side effects. Know the difference between a side effect and an adverse effect, right? Side effect might just be uncomfortable. You might feel upset, you might have some gas, you might have a little cough. But an adverse effect, like chest pain or numbness and tingling or fainting, it can actually mean a trip to the hospital. So you want to be sure that any medication, whether it's a combination medication or a certain class, that you know the difference between each medication you're taking, okay? And also how they interact with each other. You may be on several classes of medication. You want to know how each new medication interacts with the other medications you're taking, or herbal supplements. If you want an in-depth discussion about medications, I have the information here. There are so many and so many are being produced, but if you have any specific questions, or if I see an overwhelming response of certain medications you want to know about, I'll do some research and I will make another video. So please let me know. If you enjoyed this, if you had any experience lowering your blood pressure using strategies and techniques to control your blood pressure, and you think it would be helpful to share this information with others out there, feel free to leave your comments in the description in the box below, and I will be looking forward to hearing from you. If you like it, be sure to like and subscribe and share this information so we can get it out there. Thank you for watching, and I'll see you next time.